Okay, another question here reads, Good evening, Doc. A few years back, I had a massive heart attack, lots of CPR, and a few rounds with the defib. Fast forward, and I'm healthy, active, and back at my job as a biomedical tech. Long term memory is as good as it ever was. Short term memory is better now, but still poor. Example, I just went to a training and found the class extremely hard to follow. After some repetition in my general knowledge, I can do routine service. For repairs, I need assistance. Multitasking is more difficult now, as is learning I have to be cautious where I park my car as to not lose it. A recent MRI showed no damage, and the slums test showed average for my age. But if you separate the long term questions from the short term questions, you see that all the wrong answers were pertaining to short term memory questions. Would the neuropsychological test be a good next step? Good question. So, when you have a heart attack, you might not think about cognitive issues stemming from that. But when you have a heart attack, essentially you have a loss of blood flow and a loss of oxygen to the brain. Depending on how long that goes for, you can have what are called anoxic injuries to the brain, where the brain loses oxygen and that causes cell death at certain parts in the brain. The types of effects this can have can be quite varied depending on what region of the brain was impacted, how long somebody was without oxygen, the extent of the injuries, et cetera, et cetera. It says a few years back. And so when you have something that is an insult to your brain, meaning a brain injury, a stroke, an anoxic injury like this, you typically see the most improvement in the first year of recovery. So you see often a dramatic recovery, especially people who have had a stroke where they've lost a lot of skills like their ability to talk fluently or their ability to walk, use their hands. You can see dramatic improvement in this first year. And that's because the brain is really good at healing itself. After a year, it definitely slows down a bit. And it's not like it goes skyrocketing and then a sudden plateau. It kind of levels off over time. And some of this has to do with how much effort you're putting in, how many resources you have, what sort of resources you're taking advantage of for therapies, et cetera. But yes, after a couple years or a few years, it definitely slows down. You can continue improving your brain, you can continue improving your cognitive skills, but you're not going to see that massive increase like you did early on. So for this person, there's been a huge bounce back. Long-term memory is as good as it ever was, so meaning information learned in the past. But short-term memory is giving some issues, like the example of parking somebody's car, not remembering where you put it. That's a really good example of short-term memory. We're talking about things that happen within a day, being able to put those into your memory and then reliably hold on to them to retain those memories. So a couple diagnostics they mentioned. They said an MRI, so that's a magnetic brain imaging scan, that showed no damage. So that means that there's no atrophy or no signs of additional bleeding or anything like that in the brain, which is great. That means there's no major target there. With an MRI, we can look at things like, is the brain shrinking? I said atrophy, right? Is the brain shrinking? Which could be a sign of a degenerative process like Alzheimer's disease. We can also see any blood vessel damage. We can see foreign objects or tumors. So none of that, that's great. He also mentioned the SLUMS test. Really horrible name for a test. It's SLUMS. So it's the St. Louis University Mental Status Examination, I think. It's out of St. Louis. They call it the SLUMS test. It's basically what you would call a mini mental status exam. So it goes through a few basic memory tests, some orientation questions like do you know your date of birth, the date, where you are, things like that. It's a very basic assessment, very akin to the MOCA or the MMSE. These are various other mental status exams. So nothing super extensive. And so with this person, he's asking, would a neuropsychological assessment be a good next step? And to that, I would say, yeah, definitely. I think it would be very enlightening for you because rather than just the top level basics, you would be going into more detail. So you would do testing looking at your long-term memory. So your memory for facts accumulated over your lifetime. You would be looking at short-term memory stuff. So not just verbal, but also visual, in looking at the difference between those. That can help us tell if there's any lateralized deficits in right side versus left, for example. It'll also look into executive functioning, so things like multitasking, organization, your ability to plan ahead, and things like that. So it'll be a lot more detailed. And for somebody who has had a big heart attack and has noticed actual cognitive changes, it is totally within the realm of reasonable for you to ask for this. And if you find that all of your skills are where they should be for somebody your age, Okay, then you know it's more about adjusting and trying to kind of work around the personal issues that you're running into, right? Because you're the expert on you. Your brain may be capable of doing certain things, but if you can't rely on it in everyday life, there's still stuff to adapt to. And a big part of the neuropsychological testing that I do, at least, is meeting with the person to go through recommendations and talk about sort of where to go from there. Perhaps there is treatment available, like speech therapy or certain apps that are good for cognitive training. Maybe it's more about different techniques to work around the inefficiency of your brain. Whatever it might be, getting a full neuropsych battery, as we call it, would be very, very helpful to look at all these different areas and see where your strengths are and where your weaknesses are, and hopefully be able to put the two together to help you live, more successfully. It also serves as a baseline for future comparison. So if you go in later on and you think you've improved or declined, you can compare to your previous baseline. So yeah, I think that the things you've noticed are not unreasonable for somebody who's been through what you've been through. Sometimes these things don't show up very well on MRIs because you're not looking at a big point of focal damage. It's more about kind of chronic changes in the brain that have happened. But yeah, it's totally valid. You can potentially have some issues here. You can improve and you can continue improving. So I would say ask your doctor for a referral. If you have a neurologist, that would be the best place to go to ask for that. If not, you might want to see both a neurologist and a neuropsychologist. So medical side and then the cognitive testing side. But yeah, go for it and feel free to update me.